Hello everyone, we are from small group discussion B10 and now we want to present our student project assessment that the title is Knee Osteoarthritis. And this is our student group member list. My name is Putu Aidil Tameswari with student ID number 2002511202. And let's start from the chapter introduction.
Hello everyone, my name is Krisanta Tramudraja with the student number of 2002511230. So now I'm going to explain about the introduction of our student project. So this is the big background of our student project. Osteoarthritis is the most common degenerative joint disease that causes progressive loss of joint cartilage and mostly affects elder 65 years old or more. It is most commonly occurs in the knee, which causes pain, especially when used, morning stiffness, and limitation of range of movement. The number of people with knee osteoarthritis increase with the aging population and the obesity epidemic. Knee osteoarthritis results from a multifactorial and complex interplay, but knee osteoarthritis is closely associated with age and can cause a decrease in quality of life. And this is the problem formulation of our student project. The first one is what is knee osteoarthritis. The second one is what is the epidemiology of knee osteoarthritis. The third one is what is the etiology and pathogenesis of knee osteoarthritis. The fourth one is what are the risk factors of knee osteoarthritis. The next one is what are the symptoms of knee osteoarthritis. The next one is how to diagnose knee osteoarthritis. And the last one is what are the treatments for knee osteoarthritis.
Hello, my name is Tias Paraita Birawan and my student ID number is 2002511082, and I would like to present about the objectives and the benefits of writing this student project. The first objective is to elaborate the definition of knee osteoarthritis and to explain the epidemiology, the etiology, and pathogenesis of knee osteoarthritis, and to mention the risk factors and also the symptoms of knee osteoarthritis, and how to diagnose and the treatment of knee osteoarthritis. Next, and the benefits that we can get from writing this student project is to learn more about knee osteoarthritis and increase the awareness about knee osteoarthritis by knowing the definition, epidemiology, etiology, pathogenesis, risk factors, symptoms, how to diagnose, and how to manage knee osteoarthritis. Thank you.
Good morning, afternoon, and evening. My name is Alexandra Putri Windiarto with my ID number 20025111112, and I'll be explaining about the definition of knee osteoarthritis. So osteoarthritis is also known as wear and tear arthritis or age-related arthritis. Is the most common degenerative musculoskeletal diseases that causes inflammation of the joints and affect primarily weight-bearing joints, such as the hip or the knee. So knee osteoarthritis gradually progresses for 10 to 15 years, and it also affects three areas of the knee joint, which are the medial, lateral, and the patellofemoral joint. But unfortunately, the pathology of knee osteoarthritis itself is still inadequately understood.
Hello, my name is Felicia with 3 last digit of NIM 166. I will explain about the epidemiology of knee osteoarthritis. Knee osteoarthritis has higher prevalence than other types of osteoarthritis. It is responsible for nearly 4/5 of problems of osteoarthritis worldwide and rises with age and obesity. Based on research with 9,440,250 participants, aging from 15 years old and older from 34 different countries, it is estimated that global prevalence of knee osteoarthritis was 16%. For people aging from 40 and over, the prevalence was higher, which is 22.9%. Globally, it is found that there are about 654.1 million people with age 40 years old and older who had osteoarthritis in 2020. To be more specific, the prevalence of osteoarthritis in Asians was 19.2%. It is also more common in women than men. Next.
Hello everyone, my name is Agung Ragunjat Paramangsa with student ID number 20025111193. I will explain about the etiology and the pathogenesis of knee osteoarthritis. Knee osteoarthritis is classified according to the cause. There are two: primary knee osteoarthritis, which is caused by unspecified degeneration of the articular cartilage, which often result from worn out or overuse at the age of the person. The second one is secondary knee osteoarthritis. Is the result of degeneration of the articular cartilage for no reason, such as weight gain, ligament degeneration, relaxation, and muscle weakness. Knee osteoarthritis occurs when cells in the joint, including macrophage, release inflammatory factor due to inflammation in the joint. Therefore, the articular cartilage is degraded more rapidly and occurring the early inflammatory pain. Next.
Okay, now I will continue the presentation. My name is Matma with last digit of my name R130. The risk factor. There are so many risk factors that can affect the severity of knee osteoarthritis. The first factor that increases during someone's life and cannot be avoided is age. This is because over time, the cartilage of the knee get weaker and will lose its flexibility. Those conditions make the cartilage thinner and more prone to get damaged. Besides age, gender also becomes the risk factor of this condition. Women are likely to developing the knee osteoarthritis when they reach the age of 50. Overweight or obesity also can increase the risk of developing this condition. This is because the knee is the joint that has the function of bearing someone's body weight. Because of this condition, people that are obesity have twice as many chances than people that have normal body weight to develop knee osteoarthritis. Genetics also becomes one of the risk factors for this condition. People that have family members that suffer osteoarthritis are likely to have the same condition as their family members. Just like genetics, race also could be a factor that can affect someone to develop this condition. Some races in Asia continent have lower risk than the other race to develop osteoarthritis. That's from me. Now my friend will continue the presentation. Thank you.
Okay, my name is Igustin Mudahariasta Satyadikta with the digit number of my name is 145. Today I will continue about the symptoms of knee osteoarthritis. Symptoms that occur in people with knee osteoarthritis vary depending on the cause, but the common one is pain in the knee joint. The pain also varies, ranging from mild to agonizing. Knee pain can grow gradually and deteriorate over the long haul, generally normal, or pain can have an unexpected beginning. Pain and solidness in the first part of the day, subsequent to sitting or after delayed rest are generally normal. Okay, that's all about the symptoms of knee osteoarthritis. Thank you.
My name is Indah Dewi, and I would like to explain about the diagnosis of knee osteoarthritis. Until now, there are no standard laboratory tests to confirm the presence of knee osteoarthritis. Doctors usually use some diagnostic methods to determine if a patient has knee osteoarthritis or another medical condition. These methods include, first, patient interview, where the doctor will ask about the patient's family history, when the pain starts, are there any other symptoms such as stiffness, what makes the pain better or worse, and how symptoms affect lifestyle. The second one is physical examination, where the doctor will physically examine the patient's knee, noting signs of swelling, tenderness, stiffness, and range of motion, and observe the patient's gait. Next, X-rays. X-rays can show if there is loss of joint space between the femur and tibia, which indicates a loss of cartilage in the knee. X-rays can show bone spurs, a sign that bone has tried to compensate for the loss of cartilage with extra bone growth, and X-rays are the only diagnostic tool and should be used as a gold standard.
Okay, my name is Angela Efremora, so I will continue about the diagnosis of knee osteoarthritis. The next one is MRI or magnetic resonance imaging that provides image of soft tissues such as cartilage, meniscus, ligament, tendon, and muscles, as well as bone. An MRI may be ordered if an X-ray of the knee is inconclusive, or if the doctor suspects symptoms are caused by something other than osteoarthritis. An MRI is more time-consuming than an X-ray, requiring the patient to remain still for about 30 minutes. It's also usually more expensive than an X-ray, so therefore MRI is often not needed. The next one is laboratory test for the other conditions. While there is no single laboratory test to diagnose knee osteoarthritis, laboratory tests can be used to rule out other problems such as infection or gout that also cause of knee pain. Laboratory tests may require blood draw or a knee joint aspiration, such as taking fluid from the joint. A doctor has to consider all the possibilities causes of knee pain, from meniscal tears to rheumatoid arthritis during the diagnostic process. He systematically eliminates possible causes until an accurate diagnosis can be made. Once the diagnosis is made, treatment can be started.
Greetings everyone, I'm Janice Kuswari. Now I'm going to continue about the treatment of knee osteoarthritis. Knee osteoarthritis is one of the progressive and degenerative disease that does not allow the recovery of damaged structures back. The management and treatment of this knee osteoarthritis is by pharmacological and non-pharmacological therapy. Next, the first one is about the pharmacological treatment. So knee osteoarthritis can be treated through pharmacological treatment. The most commonly used pharmacological treatment is cyclooxygenase inhibitors, or known as acetaminophen and NSAIDs. However, the side effects are severe enough that long-term use is limited. Topical types of NSAIDs have been shown to be safer, with the efficacy comparable to systemic NSAID. Next will be continued by my friends. Thank you.
Hello, my name is Putri Ordina Sadistiawan with last registered student ID number 097. Now I'll explain about the non-pharmacological treatment for knee osteoarthritis patient. So the most common non-pharmacological therapy for knee osteoarthritis patient is physical therapy and rehabilitation. There are several types of this non-pharmacological therapy, and the goal is to reduce the pain, increase the range of motion, functional strength, and also improve the mobility and physical fitness. For the types of this non-pharmacological treatment are several. First is weight loss. So weight loss is the first step that you can take to reduce the knee osteoarthritis. Because the study shows that overweight people will have higher knee osteoarthritis level than non-overweight people. Next is rehabilitation program. Rehabilitation program is a combination of several programs such as strength training, Tai Chi, hydrotherapy or aquatic therapy, and aerobic. The most common therapy that used in patients with knee osteoarthritis is strength training. It's because it can improve the strength of muscle and joint stability. We continue to Tai Chi. So Tai Chi is a Chinese traditional martial arts. This is an exercise that works slowly, so it's good to reducing the pain level. Its daily session length 20 to 16 minutes. Next is hydrotherapy. So hydrotherapy will give a positive result in flexibility and strength. It may help the patient to increasing the ability to walk normally and relieving the joint pain. And last is aerobic. So aerobic is a most common exercise in patient. So this program makes patient feel relaxed, and aerobic can reduce the joint pain, especially in hip and knee, so the patient will easier to perform their daily tasks. Thank you. Next.
Hello, my name is Freddy Jonathan. Today I'm going to continue the presentation about conclusion. Knee osteoarthritis is a degenerative musculoskeletal disease that causes inflammation of the knee joints, which are the medial, lateral, and the patellofemoral joint that gradually progress for 10 to 15 years. Knee osteoarthritis is crucial. It has higher prevalence than other types of osteoarthritis. Knee osteoarthritis is classified according to the cause, namely primary or secondary. There are so many risk factors that can affect the severity of knee osteoarthritis, such as age, gender, overweight or obesity, genetics, and race, with its common symptom is pain in the knee joint. To determine if a patient has a knee osteoarthritis, doctors need to start with patient interview, physical examination, X-rays, MRI, and laboratory tests. Knee osteoarthritis can be treated with pharmacologically and non-pharmacologically treatment as well. And these are the references that we are using during the student project. I hope that our video will be very useful. Thank you.